Two generations, one mic. Here we are again. And we have a guest again this time. And she's fabulous. Her name is Dr. Morgan Marshall.
Yeah, so she is a veterinarian. And the reason why we have her is because we are a family and we have 3 doggies, right? And for us, it's always important to keep them, live as long as they can. Our eldest dog is 15. Then we have another 14-year-old, and then we also have a 10-year-old, which we call the baby. But in this time, I think it's important that we can share some information about our pets at home. So, hi, Morgan.
Hi, thanks for having me.
Of course.
Yeah. So to set the stage, you are a doctor of veterinary medicine. You've been a vet. You graduated Texas A&M.
Yes, I graduated from Texas A&M in 2022, so I've been a vet for about 3 years, and I work actually mostly emergency medicine.
Wow.
So I work like 12-hour shifts and do just ER now. So,
Wow.
yeah.
Did you always want to be a vet?
I did, yeah. Since I was little bitty, I grew up with dogs and all kinds of animals and horses and that kind of thing. And so I knew from a really young age that that's like what was my passion.
You grew up in Texas?
I grew up in Texas, yep, in the Houston area. So kind of born and raised here, stayed here for school, and yeah.
That's good. Well, you have to have a passion. I know Andy donates a lot of money to charities for rescue centers around the world.
Adopt, don't shop.
Yeah.
Yes.
Her passion for puppies. Every day I get another video of another one that she wants to rescue.
Yes. Yeah.
If I could rescue all the dogs in the land, I
Right.
could. Oh my God. Also yesterday, I saw this video of this cow. It was the cutest little Highland cow.
The
They're
little
like
fluffy ones,
fluffy.
yes.
Oh my gosh. They don't want to give me one for Christmas. That's rude.
Well, my daughter pointed out that we have, she goes, you guys live in a 3-story townhome. Where are you going to put your cow?
Fine. I don't know. We'll find space. I know. But I think for us, our pets are more than that.
Yeah.
For us, our pets are family.
Absolutely.
And that's the way it should be. And I can't imagine being in the ER. Like, how do you even make... I don't know. I don't think I could handle it.
Yeah, it's definitely a calling for me. As far as, my passion is to help like people and their pets in the hardest times that they're going through. And, most of the people that come into my clinic, their pets are their family. It's definitely difficult, but it's also can be extremely rewarding when I can, extend pets' lives or, they get to leave the hospital and those sort of things. It's definitely not an easy job. That's why I only do it 3 or 4 days a week and have a lot, time off in between there. But, it is extremely rewarding.
Well, I would imagine, being that we're in the metropolitan city,
Yeah.
that the majority of animals you deal with on a normal basis would be cats and dogs.
Yes.
Do you ever get any other animals, wilder animals that would not be the normal pet?
Yeah, we do see some exotics, if you will, in the ER.
Like someone come with an alligator
No,
or something like that.
so wildlife, I actually legally can't treat wildlife.
Wow.
I don't have a license for it, so you have to get a special license for wildlife. If they've been like hit by a car or something sad like that, I can help them out and in their suffering and those sort of things, but I can't like treat them. You have to have a special license for that. So, but I do see things like a lot of guinea pigs, like pet birds, things like that. On the ER, a lot of rabbits, but not as much like cattle or stuff like that because we are in the metropolitan area.
Mm-hmm.
Right. And I just think like, I mean, the ER, right? Like for us, having the dogs we have, especially, I mean, we have 2 Yorkies and 1 mini Schnauzer. The mini Schnauzer is 15. And it's been 15 years of gastroenteritis.
Yeah.
Which for us, at this point, we know when to take her to the ER and when not.
Right.
Because it's always, I mean, sorry, I'm graphic, but it's always diarrhea, bloody diarrhea. It just looks like a shit show.
Yeah.
And at this point, we just realize, okay, we know what to give her.
Right.
Or what to keep on hand in case that happens.
Yeah.
So is there something that, like, I don't know, sometimes people bring their pets thinking, oh, it's an emergency. And you're like, no, just
Yeah, there's definitely lots of times where, it's an emergency to them. And I always say, if you are worried, I'm worried, come in. And, we can always at least take a look. We can have a conversation. And if, okay, go home and keep monitoring, that's completely fine. But yeah, there's some simple stuff like dogs like to get their nails caught on things and then they'll just start bleeding. And it's really, can be stressful for owners. And so they rush them in. But really, we kind of just put some like quick stop, which is medication to stop the bleeding, and then you monitor it at home. So there's some things you can have on hand, like first aid. You can get that quick stop stuff, like at the store. So there's things like that. A couple episodes of diarrhea, like you experience, with Emma. That can be kind of monitored at home. You can usually fast them for one meal and then start them on a bland diet at home, whether you get a prescription from your vet to have on hand at home, or you cook like chicken and rice, those sort of things, and kind of monitor it. But if they're ever not eating for you, having vomiting, if there's a lot of blood in the diarrhea, things like that, then we do recommend they come in on an emergency basis. But things like that, one episode of vomiting, one episode of diarrhea doesn't necessarily warrant an emergency all the time, but it's hard for pet owners to know that at home. So I say, if you're worried, always at least call your emergency vet or call your veterinarian and let them help you guide what to do.
Oh, absolutely.
Yeah.
I have a friend. Her name is Jennifer. She has a what is this? Oh, the howling ones. The ones that look like wolves. Oh my God.
A
forgot.
husky?
A husky. Yeah, she has a husky, and she always asks me, Andy, do you think I should take her to the vet? Like, her name is Snowy. Or like, should I just like stay at home? Or like, do I just schedule an appointment? I'm like, I don't know, Jen. Like, what does she have? Like the other day, like her paw was bleeding. And I think she got caught on something. Yeah. And she just leaked.
Yes.
Leaked.
Made a hot spot is what we call that. Yeah.
And of course, it looked terrifying. It swelled and everything. And I just told her, I think she just like trying to fix it, but I don't think you should take her to the ER for that. Just like make an appointment.
Yeah, so make an appointment. Yeah. There's definitely lots of things where it's like, okay, they're not actively, having an emergency, if you can get in with your vet in the next couple of days, you can do that. There's also some new urgent cares that are popping up that are meant to be kind of that in between. So you have something, you can't get into your vet, but you don't want to take them to the emergency room. Now, especially in the metropolitan areas, there's these urgent cares popping up. So just like a human urgent care, if your kid had an ear infection, but you can't get in with a pediatrician, they can help you out as kind of a middleman. So that's a nice kind of service that is starting to find that middle space for things that don't need a full-fledged emergency room, but you want to get your pet some relief on a quicker basis.
What is the worst part of your job?
Oh, yeah, it's definitely when I can't save a pet. There's unfortunately, I am a huge believer in preventative medicine because I see things that, are just too far gone that I can't, save. And just having to have those hard conversations with, pet parents that, we can try here, but, we may just be prolonging the inevitable and, or that there's something that's just too far gone. And so, a couple examples of that are potentially preventable are things like pets can get masses on their spleen, actually. It's unfortunately a fairly common form of tumor. They can be cancerous or non-cancerous, but the spleen is an organ that produces blood for the body and helps filter blood. So it's very vascular, has lots of blood vessels in it. And so if those masses grow quickly, they actually can kind of burst and it causes bleeding into the belly. And that's one of the hardest cases that I get in the ER because it's a extreme emergency, and it's something that we have to take them to surgery immediately to try and fix. And
sorry to interrupt. How do you know when your pet has that? How do you know they're internally bleeding?
That's a great question. Yeah. So the symptoms are usually can be kind of wide depending on how quickly it's happening. But things like collapse, sometimes they'll kind of cry out. A lot of my patients though will just kind of be weak and lethargic. They won't want to eat. Their gums is a really good thing thing to look at. They'll get really pale. So normal dogs' gums should be nice and pink. And so if they look, kind of white or pale, then that can be a sign of that as well. Or you kind of touch their belly and they're really painful, are kind of the symptoms that typically, kind of come in with that. But for me, like in the ER, it's usually their gums are pale, their heart rate's high, they're really weak. Those sort of things tell me, hey, I need to look, in their belly.
Oh, Jesus.
You mentioned
New level of fear unlocked.
I know. It's mostly larger dogs, so, it's less likely for your babies, fortunately. But, talking kind of about things we can do to prevent that,
right.
Is early detection is the biggest thing. And I am a huge proponent of early detection for our pets. And, I think, I know you guys had a recent podcast about human health care. I think that there's kind of this mentality of, oh, my pets are fine, I'm fine, I don't need blood work, I don't need diagnostics, it's expensive, those sort of things. But there's a reason that we as vets, recommend these things for your healthy pets, and it's early detection. And so for like the spleens, I'm a big proponent of having your vet do brief ultrasounds yearly, because we can detect those masses before they become an emergency, and we can schedule a surgery to remove that potential bleeding factor, and save the pet. And for the non-cancerous masses, it's curative, and then they won't have that emergency. And same with kidney disease or other things like that. If we can catch it early, we can prolong their life. And so that's why early detection, yearly blood work, ultrasound, x-rays is actually really important for our pets, because they can't tell us if they're having a pain somewhere.
We do blood work probably every 6 months.
Yeah.
And we also do ultrasounds every 6 months on all three of them.
Perfect,
and so because exactly what you said, we've managed to catch some things.
Yeah.
We absolutely prolonged Emma's life because we caught, what did she had? She had a really...
So when she was 12, suddenly, and we thought this was just the age, right? So the schnauzers are always, again, picky and like with the food. And then she was just wanting to eat, not her food. And she was getting very sleepy all the time, but I thought she was just lazy.
Right.
So she will be sleeping all the time. And suddenly...
Also very overweight.
Yeah, in 3 months. So she waited, how big she was? Probably about 15 pounds. And then in 3 months, she went all the way to 22 pounds. And I was like, this is not normal. Like, there's no way she's just like gaining that much weight by eating the same things. And again, like at this point, I thought maybe she's getting older, but I was like, no, something is not right. So went to the vet, and of course, blood work, ultrasound, everything. Well, the vet in Spain, because her vet is in Spain, she told me this blood work has more red than like anything I've seen in my life. Wow. I was like, oh my God, Menchu. Her name is Menchu. And I was like, Menchu, what do we do? She's like, I don't even know what to target first. So she had diabetes. She had, her gallbladder was about to burst. She was like, she had also problems with her thyroid. Yeah. And also kidneys. I was like, oh my gosh, this is it. And she's like, don't worry, we're going to treat her and let's see how it reacts. Well, we started with thyroid medication, which was great. She lost all the weight. So that was the thyroid. And that was causing the diabetes. And also
extra weight and
everything. The extra weight. And also the gallbladder, well, that was an extra thing. And we treated her with... there's this medication which is...
Ursodiol?
Yeah, that, Ursodiol. And she still takes that till today.
Right. It's amazing medication. I love that medication.
We couldn't do surgery because, it was a 12-year-old dog already.
Right.
And after that, you'll see, guys, like this dog nowadays, she's 15. Right. She's in a perfect weight. She's still picky with her food, but whatever. That's her, naturally.
As judgmental as ever.
Yes.
She judges.
I love a good old schnauzer.
She looks at you like, where are you going? Where do you think you're going, woman?
Yeah, my dog doesn't bite. She judges you. That's Emma. Yeah. And now, again, like, because of that preventive thing we did, like the blood work, otherwise she will be long gone because we thought it was just her getting older.
Right.
And that wasn't it. The other two kids, puppies we have. Same, like Bonito. He also
He's the 14-year-old.
He's a 14-year-old. He was having also like a little bit of a um, lump in here. Thank God that's not bad or anything. But also he was drinking a bunch of water and pissing inside the house. And we thought this is not normal.
Right.
So he has Cushing Syndrome, it's called, which we detected again.
With blood work.
With blood work and everything. Now the little one, that's... she's a little shithead all the time, but she never gets sick or anything, right?
She just sounds like she's
She
choking.
just sounds like she's choking, but
because she's
from
overweight.
her collapsing trachea.
But that's the thing, and with Yorkies, they sound like they're choking, but that's just their normal basis. And we also run. I mean, if we're running analytics on 2 of them, just do the little one too, and she's perfect all the time. She doesn't need anything. And I'm telling you, that's the main key. Do preventive things.
Absolutely.
Not because they're dogs, and I get it. Here, I'm telling you, I try my best not to take them to the vet here because especially the ER, like they take up. Why would they do that? They take your pet away. You cannot go in there with your pet.
Yeah, and so there is a new kind of model that's coming out. There's some ERs in town that like have an open concept, so you stay with your pet the whole time in the ER. But that can be definitely really stressful. And we at my practice try to do practice what's called fear-free medicine. So we try to limit the stress as much as possible. So part of that for pets is keeping them with their owners as long as we can and keeping them in the room and those sort of things. Obviously, there's some cases where we have to rush them back and they can't stay and those sort of things. But I obviously that can be really stressful for owners. So I definitely try my best to communicate the whole time and keep pet parents with their pets as long as we can, and then obviously to take them back for diagnostics and things like that. But it can definitely be very stressful.
I mean, I can tell you, my Emma, every time we take her to the vet, she's shaken without control, and her blood pressure is to the roof.
Yes.
Why? Because she's scared. Because she's like, they're touching her and everything.
Right.
And she also has this high blood pressure in her lungs, so she needs to take Viagra every day. Yeah, to fix that. But every time they take her I don't know, it's like an EKG or something. And she's so stressed because they're touching her and she doesn't know what's happening, but it's part of that. So
right.
if you don't have your pet and they don't see you and then some strangers are just touching them, they're like, what's happening?
Yeah, because you can't explain it to them, and there are medications that some pets do really well on, like before vet visits. It's kind of part of that fear-free mindset in veterinary medicine. And some parents, pet parents are a little bit afraid of it. Like, I don't want to give my pet more medications, but there's some medications we can give them that are just anti-anxiety medications that you just give them like the night before and like a couple hours before the visit. And I've seen massive changes in pets where they wouldn't, they would get aggressive in the clinic because they're so scared and things like that. And it's been really transformative for them. Obviously in the ER, it's a little bit harder because they're bringing them in an emergency. But for regular visits, I definitely recommend people kind of talk to their vets about, what are ways that I can make this less stressful, because we want you guys to, bring your pets into us so that we can find things and not be stressful for the pets.
Yeah, that would be, we should. For Bonito, for sure. Well, no, our Bonito, the 14-year-old Yorkie, he just loves going to the vet because they always give him like
treats.
Snackies.
Yep. We love to give treats. We're like, we want it to be a good experience. We want you to come here.
He's just there
he
for
just
the
goes
treats.
and gets poked for the treats.
Yep.
He doesn't care.
I love that.
Here's the funniest thing. So you could be poking him, like withdraw blood, anything.
Yeah.
And as long as he has a treat in his mouth, he just sells his soul to the devil. Like that little guy.
Let it go.
Those are our favorite kind of pets.
But the other one, no. Emma will not take a treat outside the house.
Yep.
She will never. So it's very complicated, like doing that with her.
She just wants to get out of there. So what's the most rewarding part of your job?
I mean, definitely kind of I was talking about, when I get to help a pet and when they get to go back home and I get to see kind of that joy from, that reunited kind of bond between, the bond between our, pets and people is so special, I think. And that's the most rewarding thing for me is getting to, experience that bond and help to extend that is super rewarding for me. And, unfortunately, I don't always get to, prolong that. But when I do, it's extremely rewarding.
We also like to see the advancement slowly but surely here um, in Texas and in the States in general of allowing people to bring their puppies in more
Yeah.
places. You know, we've said before we live in Europe half the year here going back and forth. And in Europe, where we live in Spain, puppies are allowed everywhere. So
Yeah.
we bring them into restaurants. They sit at the bar with us. Everybody loves them. They bring their own little bowls. They bring them snacks. Everybody loves seeing the puppies. They're
And
everywhere.
sorry, if you're one of those people that, ooh, but dog hair, there's worse things that can happen
Yeah.
to your food. Believe me.
Yeah.
Dog hair is one of the less concerning things.
That's my biggest pet peeve when people say, "Oh, I can't imagine you're letting a puppy sit at the bar." I'm like, I can't imagine you letting your kid sit at the bar. I would rather sit with a puppy than your loud little kid that's making a bunch of noise at the bar.
Right.
You know, the bars are not made for kids. That's what tables are for.
Right.
Go over there and eat with the families.
Yes.
But you know, don't complain about the puppy who's doing nothing but sitting there and being cute, and everybody loves the puppy.
Yeah.
So
And there's definitely areas in the U.S. that are like much more, like pet friendly than Houston isn't. I don't think the most pet friendly
it's
city.
changing
but
those in different
yeah.
spots. We went to some great sports bars recently that
it's
we
called
were like,
PKO.
wow, we saw them and like they were like, yeah, you should come here and bring the puppies and
Yeah.
hang out over here. Everybody brings their puppies and sits outside. It's like, oh, I love that.
Yeah.
That environment.
There's
is
definitely a lot of like
changing.
outdoor like bar areas and stuff like that definitely allow it.
Like,
but
how do you call them? Beer houses? Ice houses.
Ice
Right?
houses.
yes,
Yeah.
yes.
Yeah. Beer
Beer
houses.
My one of my technicians, she has a little Chihuahua. He's like, I don't know, only a couple of pounds. He's like the size of a rat. I don't know. He's tiny. And she will just bring him in her purse, just like everywhere. She's like, I don't care if dogs are allowed here. They won't even know. He just stays in my purse. And
Yeah.
Like a little chihuahua?
Yeah, like a little tiny. Yeah.
I will do the same thing, but mine's are like, they're heavy. They get
Yes.
heavy.
Yeah.
And 3 of them,
Mm-hmm.
they get heavy. So what would you think? I think our people viewing, they're very interested in knowing like the most toxic foods for dogs that we have at home.
Okay. Yeah.
And also cats. I don't know if cats are even like allergic to something. Those are
Yeah.
little evil things. I love cats. We had one. but
So,
they're picky.
definitely most toxic things for dogs and cats in the house are going to be things like chocolate is extremely toxic for pets. Onions are very toxic. And then a lot of like, kind of medications, like people think, oh, my pet's in pain, I want to give them medications. But our human medications, especially like for cats, acetaminophen is really toxic for them. So like, you think, oh, I'm helping them, but it's actually can be really, really dangerous and require a lot of hospitalization and things for them because they can't process it correctly.
Wow.
And then things like, ibuprofen for dogs is not good for them. It can damage their kidneys, and then. Yeah, so those are kind of the big things that everybody's gonna like kind of have in their household that your pets may get into.
At what point, like, do you, for example, because dogs are dogs, right?
Yeah.
Like, if they get a hold into like some chocolate, like,
Yeah.
at what point is like, do I take him and rush him to puke, or is this amount okay?
Yeah, that's a great question. So, especially for chocolate, it is actually dose dependent. So, a really great resource in general, if you think my dog ate something that may be toxic, is ASPCA Poison Control. I love their service. You call them. Sometimes there's a little bit of a wait on the phone. They ask you for a small fee, and you get to talk to somebody, and they will consult with a veterinarian and tell you if you need to take your pet into the vet or not. Oh. And it is life-saving for a lot of pets. And so if you ever think your pet ate something toxic, please call ASPCA. Like that is. And if pet owners call me and say, "Hey, my pet ate whatever," I say, get on the phone with ASPCA while you're on your way here. That way I can immediately know what their recommendations are, because I can't know, every toxic thing. And they're just a great resource because they have veterinarians that specialize in that. So they'll give me treatment plans for them. They'll tell me, exactly the step-by-step what I need to do to help your pet the best. Because, things like chocolate, like I know exactly what to do for a chocolate toxicity because it's so common, but more rare things, medications, supplements, treatments, other stuff like that, that's a great resource for veterinarians and for pet parents.
And that's also for cats and everything?
Yep, cats, dogs, they'll help you with any species.
Well, that's a great resource. Thank you.
Of course.
Well, definitely, that's a great resource to
Yeah.
have on hand at all times.
Absolutely.
Yeah.
Well, we can't stress enough the importance, we think, and we promote this all the time, is rescue and
Yes.
adopt, don't shop.
Yes.
They're not disposable toys or gifts that you're infatuated with or your child is infatuated with for the moment, for the holiday, whatever it is. It's not a Christmas present. It's a lifelong commitment.
Right.
And they're expensive.
And, you know, I always say, I apply, you shouldn't treat your puppy or kitty or whatever any difference than you would treat your human child. So would you do that to your human child?
Right.
Then you shouldn't do it to a puppy.
Right.
You know, you shouldn't chain a puppy to a tree.
Yeah.
I mean, and hopefully they've outlawed that.
Yeah,
That's
the laws have really gotten much better about that too, as far as, you know, you can't leave your pets chained outside. It's illegal, you know, now, and they have to have shelter and food. And in Houston, they have investigators that that's their sole job, is to investigate animal cruelty. So it's definitely something that, you know, is continuing to improve as far as like the pets' rights.
Yeah, you know, we were so happy in Madrid, in Spain, where we live, that they enacted these laws. It's new laws they have there, which guarantees puppies and animals and things almost the same rights as humans.
Yeah.
So if you chain your puppy up like that, you're going to jail.
Yes. Yep.
If
It's
you
the same
leave
in
your
Houston,
puppy longer than this period of time,
like you
neglected,
cannot leave your animals by themselves at home for a longer period of time. Like a dog is different than a cat.
Right.
A cat can, like, I think they're a little bit more independent, but at the end is more you shouldn't be leaving your animals by themselves,
Right.
like at home, because
for a long,
long
an exorbitant amount of time.
days at a time is just
you will go to jail.
Yeah.
And that's good. And you know, God forbid you get caught abandoning a puppy. I think if you take a poor little puppy that's been in your family and just, I'm getting rid of this puppy, and just drop him off somewhere, you
should
are
die.
a piece of shit.
Yeah.
Again, would you do that to your child? Oh, I'm
Maybe they
tired
will.
of my child.
Yeah.
I'm going to drop him off on a lonely street somewhere.
Yeah, and if you're moving to a place where like, oh, no pets allowed, I need to get rid of my pets, well, find a place that allows pets.
Yeah.
Fine.
Absolutely.
That's the
I know,
other
that's
bullshit
always
excuse.
the
Oh, I got to move and they don't
saddest,
allow pets. They allow kids? Same thing.
Some places
No
don't.
difference. Yeah, they shouldn't. No difference. No difference. So find another place to move. They're all bullshit excuses. You just making up crap
Yeah.
because you don't think of them as like a
Living creature.
Well, and
you know,
there's
living
so
creature.
many pets that do need homes. You know, the statistics have been improving, but you know, there were, I think, almost 7 million pets that went into the shelter in 2023, and only like less than 7 million, and like only 5 million got adopted. And so, you know, there's a huge disparity. And unfortunately in America, you know, a lot of those pets are put down because they can't find homes. And there's some states where, you know, they don't do that, where it's illegal to euthanize a pet just because they don't have a home. But, you know, not all states are like that. And
I think California was like that.
California.
I think
California.
it's,
Because they also outlawed, that's another thing we're not big fans of. They also out in
Selling.
California breeding them for sale, for profit. And they outlawed that in California. You can't breed animals for profit like that, puppies anymore.
Yeah, like they cannot, like the pet stores can't sell.
Yeah.
Really? I didn't know that.
Yeah, they stopped all that. That's outlawed in Spain too. You can't breed
I mean,
them for profit.
there's definitely, I do think there's ethical breeders. Now, am I a huge proponent for adopting? Yes, I have 2 adopted pets that I love, you know, more than anything. And so I think that if it, you know, if you're just trying to find a companion, the rescue is a really great place for that. But there are ethical breeders out there, and there are, you know, reasons for breeding certain breeds, like working dogs, you know, labs and things like that, you know, police dogs, those sort of things. And even some, you know, companion dogs or hunting dogs and things like that. So if your dog is going to have a job, then, you know, you may want a purebred for that job. But they have to be, you know, ethically bred and bred for a purpose. And, you know, so definitely doing your research if you're trying to find a specific breed for a specific reason. But definitely if you're just looking for a really great companion, at least start with the shelters and then, kind of go from there.
Yeah, rescues always.
We
Good.
should
All
do
three of
better.
ours are rescues from
Yes.
different times, and they're our babies, and we love them more than life itself. So
Yeah, so, well, thank you so
Yeah,
much
Yeah,
for
we
being
could-
with us.
we could talk to you forever
Oh,
about
yeah,
this. This is great.
So
if whatever that I think the best thing that people can take from this is what you said, the ASPCA.com.
Yeah,
is
ASPCA Poison Hotline.
Poison
Yeah.
Hotline. Okay.
Yeah.
SPCA Poison Hotline.
Is the best thing to do there, and adopt, don't shop.
Yes,
And so,
yes.
thank you.
Awesome.
Well, thank you so much, Doctor.
Of course. It was so great being here.
Well, don't forget to subscribe, like, and share. If you guys have any questions or suggestions, also let us know.